what are the elements of marketing that a practice needs to expand on a long-term, continuous basis. So let's take up the basic 4 factors. Now, the 4 factors I'm going to give you are exact and very precise. There are only 4 factors to practice growth, and only these 4 factors. The first one is new patient acquisition. That's factor number 1. Factor number 2 is when the patient comes in, you now have to upsell or get that patient to accept treatment. That's called treatment plan acceptance. If you get a patient acquired and they come in the door and they don't accept treatment, there's no sense in getting them in the door. Factor number 3 is patient retention. Now that you have them, they've come into the practice, they've actually bought something or have some sort of treatment plan acceptance, you now want to retain them to come back and complete treatment and or to continue on with recall. The last factor, which is factor number 4, is patient reactivation. And reactivation is a dormant patient who has gone inactive for anywhere between 18 to 24 months. And if you can get that patient to come back in, you've retained a patient base and you're building a patient base. New patient acquisition, treatment plan acceptance, patient retention, and patient reactivation. Those 4 factors, when a marketing plan is implemented in a practice, there are no other factors than those 4. If you have those 4 factors upon which to align all your marketing efforts, and they hit all 4 factors, your practice will grow, both short-term and long-term. The VIVA system itself was developed to encompass and put in those 4 factors. The work has already been done for you. It's not like it has to be redone. You don't have to rework it. You have to put the system in, and the system itself addresses those 4 factors. The VIVA system is a patient referral system that is done internally in an office and to the database of the office or your patients of record. The most powerful source of patient acquisition that you have today, and you will always have, will be a word-of-mouth, person-to-person referral source. There's never any more powerful than that. If you survey colleagues in my own practice, I can tell you, going back 25 years ago, that when you have a referral come in, the likelihood of that referral accepting treatment is far greater by 3, 4, 5 times over an advertised public if you're doing direct mail, SEOing, pay-per-click, whatever else you're doing. So realize that an internal referred patient is the most valuable, which is what the VIVA system is focused on.